So good morning, everyone. I'm Dr. Nilesh Kumar. I'm the chief instructor of this course. Our course is known as Journey of Innovation: Finding Your Idea and Making It Global. The idea behind this course is that anyone who is attending or seeing it online, um, if you are worried that I have an idea how to take it forward, is it worth taking? It is worth exploring. If it is explored, how to make it work? Uh, does it require an industry partner? Should I do it myself, or should I invest in something and make an infrastructure for myself as well? If you have a surgical idea, is it innovative enough to call it myself? How to do everything? So my co-instructors are my guru, Dr. Ashish Sharma sir, who has mentored me in the innovation journey, and Dr. John Davis Sakara, who will be joining us shortly because he has clash of instruction courses, and then Dr. Swati Kalki ma'am, whom I met in one of the innovators competition. She is a brilliant surgeon and she is having similar innovation in surgical area. And then Dr. Prakhyat Rup, sir has innovated negative dysphotopsia ring and has worked with the industry to take it global and make it commercial. So I'll start with my talk. My talk is on finding your germinal idea. So, good evening, everyone. Again, sorry, good morning, everyone. Uh, I am talking about this because I got a germinal idea when I was working with Dr. Ashish Sharma sir in my DNB residency. The idea was very simple: to image the anterior segment angle, anterior chamber angle, because a lot of difficulty I was facing in convincing my patients. So these are my financial disclosures. Dexpro is one of its kind frugal commercial smartphone-based gonio imaging device, which is in the process of patent application, and it is compatible with 2, 3, 4, and 6 mirror gonio lens and smartphone, and it is working on single camera, multi-camera, and all Android and Apple means iPhones. This is how the device is set up for use. We place the gonio lens in the adapter, which by design aligns centrally with the optics of the smartphone holding segment, where the smartphone, whether it is Android or iPhone, is snapped fit. Normal camera app, or now we have a proprietary MI Red Cam, which images for both the Dix Pro and the original MI Red Cam, can be used for clicking the image. It is done under topical anesthesia. The lens with the holder is applied in normal fashion, and the patient is asked to look straight. The smartphone segment aligns beautifully with the lens adapter, and you just click using the camera flash. It is as simple as that. So these are a few sample images I have taken using Vogue 4 mirror lens, a few sample images using Ocular 3 mirror lens. But how did it all happen? How the journey has been? The two most common questions asked by any innovator are: how did you get uh, how did you get that idea, and how did you decide to take it forward? I will try to answer these two questions in my today's presentation based on my learnings from and my interaction with much better innovators like those who are sitting over here. Everyone has got ideas. When presented with a problem, any logical mind will say that this is the solution. Anyone in the audience who wants to innovate, focus on finding the problem, not on the solution. Find a problem that is very personal to you. Find a problem that you really want to be solved for yourself, and then let your brain do the magic. My problem was convincing the patient that they have closed angle and they required YAG PI. Even after counseling them for a long time, 15-20 minutes, they really rarely agreed for such a simple procedure, all because they couldn't understand what this junior doctor resident is telling me for, and why this procedure is so important when I just walked in for a routine refraction. The only way to convince them was to show their image, but there was no frugal technique at that time to for me to image the angle and show it to them. So that was the idea that hit me, and the solution that my brain showed was a mirror selfie. What is gonio mirror? Is it not a mirror? Are you not taking mirror selfie every time you go to gym? Can't you do the same with the gonio mirror? You go really close to the mirror and just click. That that was the basic funda behind Dixpro. So just keep listening to yourself, and you don't know where the idea will hit you. But it is not that just I just got the idea in evening and the next day Dix was born. took me just 8 to 10 days to gather that courage to first click that image. And as the luck would have it, when I was clicking the first image, Ashish sir walked into that room and he's like, "What are you doing?" And that's how he came on the journey before the idea was born. Ikigai is a Japanese philosophy which means reason of being. It asks you to answer only 4 questions about anything that you want to do, and if you answer that truthfully, you will have the clarity whether to do it or not. The questions are: do you love it? Are you good at it? Does the world need it? And will anyone pay for it for you to do it? So the first question first: do you love the idea you have got? I love my idea. If you don't, be ruthless and discard it at that place only. Sole reason is that is going to take a lot of your time, a lot of your cognition, your attention, and a lot of your time, family time also. It took 12 types of macro lens setup that we tried over the first 6 months. That is the first image we got, and the first setup. I pasted a macro lens over the cover of my iPhone OnePlus 6, and then we started taking the image. Make sure you love your idea because the journey is going to become your passion. The next question to be answered is: are you good enough to implement your idea? This decides the route you are going to take to develop your idea. If you can do it, then take the do it yourself route. That will give you complete freedom to keep developing and not to stop at a point. If you think you can't do it, but you can do it, but lack a direction, then a mentor can help you. Like I was lucky to get Ashish even before I started my journey, which has helped me to achieve what I have today so fast. Getting a right mentor will not only help you to do what you need to do, they will also prevent you from making the mistakes they have made. If you are not getting a mentor, then someone from the industry can help you, the route that Dr. Prakhyat has taken. If you are taking that route, make sure you protect your idea and do not disclose it freely. The third question to be answered is: does the world need your innovation? In simple terms, is your problem a real problem for many of your colleagues? If and is there no viable solution available for it? For me, gonioscopy is not performed in majority of patients walking in, and there is no recent advance in gonio imaging that is frugal enough and can be easily utilized for patient education. That convinced us to develop our innovation further and to propagate it. We published this technique in Journal of Glaucoma, and the quality till then was good enough to make it to the cover art of the journal. The last question really decides whether your innovation is going to be commercial or is it just going to be a jugaad. A simple question: will somebody pay for it? Once we had published the article in Journal of Glaucoma, we got so many queries that is this a device or is it just a technique? How can we buy it? And that answered the question for us. But commercialization is a very costly process. Developing even a simple attachment may cost you 5 to 6 lakhs in prototyping stage, apart from the patenting and other costs. And thus, economics needs to be understood before proceeding. In my opinion, your research and your innovation should be self-sufficient and it should pay for itself. But have we done all we could have done with the device now that it is commercial and has won multiple innovation awards and is present internationally? No, not at all. The beauty of innovation is that it keeps evolving. So the next frontier is to achieve the reflection-free image. We are experimenting with various polarized lights, filters, external flashes to provide a reflection-free 360-degree image of the angle, which hopefully soon will be available. This all is possible because I answered the first question very, very, very truthfully. I love my idea. I absolutely in love with my idea. The next frontier to achieve, so keep loving your idea, keep innovating, keep translating, and keep digging. Thank you.